video? Okay, just wanted to make sure. So as a review of what is on the tray that stays outside of the room, of course the x-rays wouldn't stay inside the room because that's where the radiology is, right? So the radiation is, so we keep them outside. Is first thing you'll get is a patient napkin with the plastic side down to protect the tray. Yes, we will wipe the tray, but it's just a good practice to have this plastic side down. You will grab a transfer box, that's what these are called, transfer boxes, and this will hold all 18 of your phosphor plates. You can arrange your phosphor plates as so, with 6 of them horizontal, 6 of them in a vertical fashion, and 6 of them in another horizontal fashion. And the reasoning for that is because it does directly mimic the puzzle piece that we'll be mounting for you someday. And it's a good order. We will teach you an order to do it in so that you don't miss any of the teeth or miss any of the x-rays. So we'll have you open this, take these like that, set them down in this fashion. There's a method to all this madness, and we'll explain it. As a review, these are XCPs. These are our semi-critical instruments for radiology that go inside the mouth. Semi-critical because they don't puncture anything. The yellow is for posterior teeth, blue is for anterior teeth, and the red is for bite length. It looks like a Rubik's Cube, but you will be able to master these by the end of our radiology segment. This cup is not for rinsing. This cup is actually for trash. I'm going to demo in a second how to clean up how to remove the barrier from the PSPs and put it inside there. This is in case your patient has, sometimes if you're removing the XCP, a little spit can come with it, kind of like string cheese. So you can kind of dry it up if you want, or when you bring the x-ray back here and take it out of the XCP, it's still wrapped, of course, and sometimes you might need to give it a little dry so you know it's not going to contaminate. And the best method to unwrap any of the phosphor plates after taking it inside the mouth, so for example, we'll go with a posterior x-ray, and we'll just go through this like a simulation. This is a posterior x-ray. The way that it would go inside the XCP, we'll explain all of this in detail. However, the way this goes into the XCP is the black side into the ring, so that when you bring the camera around, let's say someone's biting it like this, when you bring the camera around, it radiates the black side because that means it's on the inside of the phosphor plate. The outside of the phosphor plate, this little plastic piece inside here is black. The inside's actually blue. You wouldn't know that because it's covered. But that's the piece that collects the image. So that blue side, which is really the black side, should be facing the ring so that radiation can penetrate the blue side. If you take it with it backwards, you will not get an image because radiation is not touching the proper area. Also, each of these phosphor plate bags, the phosphor plates that are inside the bag have an A in one of the corners. And that is very useful for orientation and mounting, digital mounting. So when you are putting it inside of the XCP, we want the A into the XCP, into the slot being held. And what that means is that it will typically go along where the teeth bite. This will make a lot more sense when you're inside the mouth too. So let's say this was just in the patient's mouth. We shut the door, we hit our button and said clear. We opened our door and we take this out of the patient's mouth. Now this has saliva on it. If I take it out of here and I'm like, whoa, it really has a lot of saliva, I can give it a little bit of a dry over here in case you drop it. And then I'm gonna put it back on a black side and continue my whole FMX until my FMX all looks like this. Once your FMX looks totally like this, meaning that you have exposed all 18 of your images, there are 18 images here. Once your FMX looks like this, it's time to unwrap and bring them into the scanner room. So I'm just gonna unwrap the first one that we did. When you're unwrapping this, the reason why we have this kept open is because my gloves are contaminated now. So I can't go touch this right now. It needs to be open already. So now, because this is nice and open, you're gonna take your XCP. One side of this XCP has a little V. Can you all see that little V? Mm-hmm. It has a small little V right there, and that little V is the beginning to tear it. You know, in those movies, they always cut the shirts. They don't just rip it from fresh, you know. There's always a V. So this little V here is the helpful area to know to pull from that side. So we call it tear and plop. We want you to tear it from side to side like this. Now you're thinking, Miss D, your hands are contaminated and you're about to touch that. No, the whole point of doing this properly is to tear it, shimmy, 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 and let it drop. Here's the blue side. You never want to see that blue side. You want to lead it all the way toward the box, let it drop in. I never touch that. And now that's where that goes, okay? Now that's where that goes. Once you've done that with all 18 of them will be inside here like this. If you accidentally plop one of these on the blue side, what you can do, what I do, is on my next one, I try and turn it over. Try and bring it around, because once you are exposing, once that blue side touches the light, it starts to lighten. It starts to expose. So I know this isn't X-ray radiation, but it's still energy that can expose that blue side. It's very, very sensitive. And last semester, we had a student do it for, we counted up to 3 minutes by the time she got there and turned it over and we figured it out, and her image was very light. So within seconds, really, it can begin to expose. So it is important to try and keep them down. Like I said, if one goes that way, try and use your next one to kind of turn it over. You gotta have some finesse, because the idea is that that blue side has your image. You don't want to over radiate. We want to still take as low as reasonably achievable, ALARA, which you guys will learn that acronym. We still want to take as low as reasonably achievable that we can inside the patient's mouth. So once you do that with all 18 of these, so let's just pretend all 18 are inside here, these are contaminated. So should I just close this and walk? So you got to take your gloves off properly. And then we're going to throw these out. And then you can close your box. You might want to space them out a little bit in here. If you make a stack of 18, this won't close. So just kind of spread them out a little bit. And then you're ready to take this into the Scannex. The scanner room should have 0 contamination, because this was never touched by anything that had saliva on it. This is completely clean. You can lick it. Don't lick it. But you could if you wanted to. Okay? So does anyone have any questions on infection control from this side?